welcome everybody to the City Builders Podcast. I'm Todd Jones, your host, the president and CEO of the Reading Chamber of Commerce, and I am super honored to be here today with Todd Smith, the CEO of Mercy Medical Center Reading. You were on the board of the chamber many, many years ago, and I'm really excited about our conversation today. We're going to talk about the Sierra Pacific Regional Cancer Center. We're going to talk about physician recruitment, challenges in healthcare, and why the North State is such a great place to live and work and practice medicine. So we hope you stay tuned for this episode and join us on the City Builders Podcast. Thanks for being here. Welcome to the City Builders Podcast, brought to you by the Reading Chamber of Commerce. I'm Todd Jones, president and CEO. In each episode, we bring you insights from local business leaders, tackle important issues, and explore what's shaping the future of Reading. Whether you're a business owner or just interested in our community's growth, this podcast is something for you. Thanks for joining us. This is City Builders. The City Builders Podcast is brought to you by Obsidian IT. Obsidian IT is a Reading-based, employee-owned technology company providing simple, scalable, outsourced IT for your business. Discover how Obsidian cares about IT and give them a call at 530-242-6000 or obsidianit.com. Obsidian keeps us running at the chamber, and we could not do business without them. I heard about one of your greatest achievements, and I don't know if you would agree this is one of your greatest achievements, but you were the 1997-1998 NSCIF North State Basketball Coach of the Year. Mm-hmm. Was that the right year, 1997-1998?
Yeah, near as I can remember.
What was that like? I mean, that's a big deal to be a section basketball coach of the year.
Yeah.
What was that season and that team like? You guys went to the championship, I think, that year as well.
Yeah.
Who did you beat? Tell us about that year, that time of your life.
The team was awesome. I mean, just a bunch of hardworking kids. I'm sure you know Jake was part of that team.
Yeah.
He probably told you the story.
Well, I also said it's because it's a small school, everyone made the team. Yeah. And he said, maybe that's true, but we also worked our butts off.
Pretty much. They did.
Yeah.
It was a great team. They all filled their roles. It was nice to have that senior-led team, right? You forget how much the maturity of a senior matters in high school.
Right.
And it was a senior-led team. Jake worked hard. They all worked hard. We lost to Liberty in their tournament by 20 plus.
Wow.
It was bad. And then, they were in our league. They were rivals. And so in the section final game, we played Liberty again and beat them by 5-4. But it was great. It was very satisfying. Not so much the Coach of the Year thing. For me, it was the team and what they accomplished throughout the year. It was awesome. We were the underdogs going in. We were a low seed or a high seed.
Yeah.
Nobody believed that we had the talent that we did. And we went on the road to Delta and beat Delta.
Wow.
When Delta was supposedly the best team in the thing. And, and it was great. It was very satisfying. It was so much fun. I got a lot of new shirts and ties that year.
Oh, good.
Because during the playoffs, my wife bought me a new shirt and a new tie.
Did you wear a tie
game.
coaching?
Oh, yeah.
Well, there's a lot of basketball coaches that still kind of dress like that. Not as much as they used to, but that always kind of blew me away because I watch a lot of football, and those guys, you got Bill Belichick wearing like a cutoff sweatshirt, but a suit and tie coaching a sport, it just seems pretty. It adds another layer of difficulty.
Yeah, I mean, it goes. For me, it goes back to when I played, right? And what'd you do? Game day, you wore ties. You respected game day.
Yeah.
And as a coach, I did the same thing. I wore a tie every game day.
That's awesome.
So yeah,
I'm teaching my kids a lot about sports right now, and I'm a big fan of Coach Prime. I know he's kind of a polarizing figure, but he's got this saying, Deion Sanders: "If you look good, you feel good. If you feel good, you play good. If you play good, they pay good."
Yeah,
so I like to, my kids like to, they like that line. They like to look sharp and have all the extra junk that they wear these days to play sports. But
yeah, it's kind of I'm just a throwback.
Right.
I don't. For me, it was just about the game.
Yeah.
And working hard and achieving what you achieved as a team. So
that's awesome. Yeah. That's really cool. So you are a North State native. You've been here pretty much your entire life. How did you get started in healthcare? What was that first exposure to healthcare to think, this is what I'm going to do?
I tell all my new employees that I was an EMT at 8.
Wow.
And they kind of look at me like, well, how can you be an EMT at 8? Well, my mom and dad started the ambulance service in Anderson, California when I was about 8.
That was a private thing, a private ambulance service.
Yep, private ambulance service. And you didn't leave your 8-year-old home alone at night. And I used to go on all the ambulance runs with them.
Wow.
And it was, I would actually hold broken arms and splints. And it was, it was different back then. You really didn't treat anybody. You got them to the hospital as fast as you could. And so I that's where I got my passion around helping people, and thought I could have a career in healthcare. And I never forgot that.
Wow, that's amazing. So did you actually have an ambulance at home, and that you were on call there, and your parents would just get a call?
Yeah.
Were they paramedics or EMTs?
I have my mom's license on my wall. It was a 24-hour class.
Okay.
It was my mom.
24 hours.
24 hours. My mom, my dad, my 2 uncles, and my brother-in-law all were the ambulance crew, and they would alternate.
And so was it like a big white ambulance like we see today, or?
64 Chevy van.
Wow, okay.
Held 4 patients.
Like a panel van.
Yep. Panel
Okay.
van. Yep. Held 4 patients.
Four. A lot. I don't feel like a lot of ambulances carry more than one these days.
Yeah. Yeah, because
efficient.
there wasn't a lot in them. There was an
Yeah.
O2 tank, and there was a bunch of bandages and splints, and they had 2 beds low and 2 beds high in the back.
Wow. And then where would you take them back then? Where was it? Was it Reading Med, or what was the hospital?
3 hospital town. You had
Okay.
Shasta General.
Yep.
You had Ready Med. You had Mercy.
Okay.
My mom and dad always preferred Mercy.
Okay.
Patient hardly ever told you where they wanted to go, so the majority of our patients went to Mercy.
Okay. And then Shasta General, was that a county-run hospital?
Yes.
Back over on Breslauer?
Yes.
Gotcha. Which the building is still there. Obviously, the hospital's not there anymore.
Yeah.
Wow. So tell us about Dignity Health. Dignity Health has a lot of things that happen in this community. Can you kind of break down the big buckets? Obviously, we know you have a hospital, but what are the other things, just briefly, that Dignity Health does in the North State? What are the other components of the organization?
Okay. We have over 31 sites, and I'm including the hospitals in Red Bluff and Mount Shasta. 3 hospitals in that section, although our market has a 4th hospital, Sierra Nevada now. But locally, 3 hospitals. We have clinics. We have oncology clinics, primary care clinics. We have our the residency program. We have connected living, which is not necessarily healthcare per se. It's about keeping people healthy and out of the hospital, which is something we pride ourselves in. 31 sites, and that pretty much encompasses it all. It's all pretty much healthcare oriented, plus connected living.
So I'm on the board of Connected Living. I'm a new board member, and I really didn't know a lot about it. So they do older adult care. They take care of people. They have I call it an adult daycare. I know that's probably not the technical term, but it's kind of an older adult daycare. But one of the things I think is so tangible for our community is Dignity also is the food bank for a multi-county area. So has that always been part of Dignity, or did Dignity when did they step up to the plate to take over the food bank for such a large region? Again, I'm putting you on the spot here.
But it's okay, because I wasn't here when that was established. It used to be Golden Umbrella, and then it changed to Connected Living. One of the first things they did was food bank, because the sisters saw a need, and the sisters, they came to California for education, not healthcare, and they saw a need that healthcare was the need, and that's why they got into healthcare. I think Golden Umbrella is really no different. They came to this community, they established a hospital. They saw a need, and that was a food bank. They felt like a lot of individuals needed that help to survive. And so Golden Umbrella developed, and it's expanded into transportation. It's expanded into just so many different areas.
Right. It's amazing. I had a chance to, the Saturday before Christmas, I was able to do the food distribution. There's food distributions a few times a month up at Dignity Health Connected Living on College View next to Simpson University. And we served about 800 cars that day, and I was amazed to see the different levels of people that come through the food line. And, it's pouring rain, it's cold, but the people are so happy to get food. People are in line for hours. I got there at around 6:45 a.m. People were probably in line at 4:30 a.m. waiting to get food before Christmas. And it's just an amazing thing that they do that service there. It's a very efficient operation. The forklift drivers are bringing out pallets of stuff. We're all packing in these carts and then literally putting it into people's trunks. And it's pretty amazing to just see, like, hey, this is all part of this big healthcare ecosystem here. And it was really impressive to see what all the things that Dignity Health Connected Living does, but that one in particular was pretty moving. So It's a cool program.
Thank you. We're very proud of that. Joe Ayer does a great job.
Yeah.
He's very passionate about that service. But I think it's about what Dignity Health is, right? It's more than taking care of you in the hospital. It's about keeping you healthy. It's about keeping you functional within the community and making the community a better place to live. And that's what we're about. That's why we do what we do.
That's great. So tell us about some of the other projects. The other big one that's been in the news a lot lately, I think a lot of our listeners probably know, but you recently broke ground on a new regional cancer center, the Sierra Pacific Regional Cancer Center. So how many years has that been in the making? And tell us a little bit more about that project.
Yeah, Cypress and Hartnell. been in the making before I got here. It used to be called the Wellness Center back in 2015, 2016. We took a trip to Baltimore, Maryland to look at what their wellness center looked like, a recommendation from our corporate office. Realized we didn't need that size of a building or that size of a space. But what really made sense was a cancer center. When you look at the way we offer cancer services at 2 different sites, actually 3 different sites, the way we do some of the infusion that supports cancer, it's just you have to go to so many different places. And you know, my family, I've had numerous members of my family with cancer.
Sure.
And to see them go from place to place and to call me and say, where do I go for this? Where do I go for that? It just kind of all came together to where if we can develop one area where they go for their cancer services, once you've been diagnosed with cancer, it's just the best thing and the best way to do it, to set their mind at ease to where they can focus on healing. They can focus on that, that way to get your mind off what you're going through. It's down by the river. It's looking west. Sunset. There's so many advantages to that site, and so many advantages to bring it all under one umbrella, from counseling to just everything.
That's amazing. I mean, I think we all probably know someone that's been touched by cancer, so it's a really a needed thing, and it's going to serve a big need for our community. So with this cancer center, do we have enough oncologists to staff this? I know that's a big challenge as well. Physician recruitment and oncologists specifically, I'm sure, is one of the challenges that we have. Is this going to help us bring in more oncologists to the area?
I believe it will. We have successfully recruited 3 medical oncologists and a APP, or a nurse practitioner, that's been doing cancer care for 20 years from the East Coast. So I think one of our issues with medical oncologists is we're so spread out, right? I've got a couple of docs at the hospital, I got a couple of docs down on Hartnell, and by getting them all under one building and showing them our vision and showing what we're trying to offer for these types of patients, I think without question helped our recruitment in that area.
Yeah.
We are very fortunate to have a new partner, Dr. Nurani with IROC. They do a nice job on the radiation side, and they also employ the medical oncologists in our clinic.
Okay.
Is the way that works, because as a hospital, we cannot employ physicians.
Right.
And so I'm really excited. We've got, like I say, 4 coming. We've got at least 1 or 2 site visits planned. We plan on bringing up to 7 to 8 medical oncologists when it's all said and done to meet the population's needs. And I think we are well on our way to achieving that.
That's great. So when is the anticipated opening right now?
I keep being told a year from March.
Okay, that's pretty quick.
Yeah, they say they can get the building up in 13 months.
And is this is this phase 1? Are there more phases after this as well?
I'm not going to say there's more phases.
Okay.
I'm going to tell you there's land there to expand.
Okay.
So if we want to move our medical foundation down on that site, we can certainly build a building and do it.
That's great.
There's building site A, B, and C.
Okay.
We're in the middle one for the oncology center, so there can be one to the northeast and one to the southwest.
Okay.
So.
Great. And it's really going to improve that area of town too.
Yeah.
That piece of land's been empty for as long as I know, and that area of Hartnell has a lot of room for growth. So hopefully that is just a seed to get the rest of that area continue to be built up. And Cornerstone put a bank there a few years ago that's kind of added a lot, but this is going to be a really nice piece right on the river. Take advantage of that riverfront that we have, and it's going to be a really beautiful building. Yeah. So
it really
we're
is
excited
cool.
about that.
Going down there on the trail and crossing the bridge and the little island there.
Yeah, you have the Nurpon open space right there, which has really been cleaned up by the city of Reading. Yeah. So it's a really nice place to go take a walk, and I think some cross country teams do the races down there too. So it's a nice spot.
We're gonna have garden walking paths on the north side of the building, and all sorts of holistic type areas where people can heal and just kind of absorb where they're at in life and get better.
Yeah, that's great. That's great. So on the topic of physician recruitment, big challenge again at the chamber. I'm hearing about this all the time. One of our things with Visit Reading is we try to I'm telling organizations in town, we're making great content. We're trying to attract people here. Use our content to help you with your mission as well. And physician recruitment's a big issue. So tell us about some of the challenges that you see in recruiting physicians to the North State and why we're experiencing the shortage that we are.
Yeah, I would tell you everybody's experiencing a shortage. It's just there are not as many people going into healthcare. It is what it is. So we've got to be top of our game to recruit any docs that we can get. So this year we brought in about 47 docs. for recruitment dinners,
Okay.
for recruitment visits.
That's a lot.
We landed about 60%. So our recruitment total now is 37, and we're up to 22. I think we recruited into town.
Okay.
Which is
very
nice.
high conversion rate.
We do. We probably screen about 80 to 90. Not all of them make it through our screening. I think what Reading has done as a whole, I mean, downtown is much improved. I think some of the things we can do and we can think about is, everybody has their fires,
right?
The hurricanes,
right.
tornadoes, whatever. There's things about Reading that people don't necessarily like, but there's so many great things that offset that. So by focusing on the great things, we're a lot better off than getting on social media and talking about the negative things.
Right.
Because the physician's spouse, male or female or whoever they are, they get on social media and they look at that stuff. They do that before they even get here.
Yeah.
Sometimes they back out of visits based on certain things that they've read.
Right.
So if we can get past that and focus on the positive, because there really is so much to be positive about.
Yeah.
I think that would help immensely with physician recruitment.
And other professional positions as well, because I know there's other people in town that are looking for attorneys and accountants and things like that. And I'm going to kind of extrapolate from here. But about 5 years ago, the Reading Chamber of Commerce started the Reading City Identity Project, and there was 20 ideas there to really help our public image. Some of that was search engine optimization, so a better online presence for the city of Reading. There was projects like Umbrella Alley, which is no longer umbrellas, but it still looks beautiful down there and improved. And I think the big takeaway for me is with Visit Reading, with the City Identity Project, which is part of the Forward Reading Foundation, which is the Reading Chamber's 501c3 foundation, we really are trying to help our own community feel better about themselves and feel, because we are our own worst enemy. All the negative publicity, all the things online, like you just said, we're doing it to ourselves. So I think the more that we can improve our morale of our citizens, I think the easier it's going to be to recruit physicians, recruit professionals, and really make Reading a more desirable place to live. I mean, that's really what we all want at the end of the day. And I know there are some that say, we don't want to be LA, we don't want to be San Francisco. I don't think that's ever going to happen. Right. We're not that big, but we need more people here. We need more physicians. We need more people that do almost everything. Teachers, you name it, there's a shortage. So I'm a big fan of what you guys are doing, and I'm hoping that as we move forward into this year and years to come, that we can just continue to kind of feel better about ourselves, because I think that's going to go a long way to improve our outlook for our community. Yeah,
I agree 100%. I think there's certain professions in life that you get a lot of, there's a lot of satisfying things that happen from working in healthcare or law enforcement or firefighting or what you do or whatever. And if we, I like to say we want to lift those people up. We don't want to, put them down. So, there's certain things out there in this nation sometimes that you just shake your head like, how did that happen? And healthcare, I'm not going to tell anybody healthcare's cheap. It's not. I have to pay too. I don't get it free.
Well, you don't?
Yeah, no, I don't get it free. And the system could be better, without question. But we make the best of what we have, and I do believe we take care of the people, and I do believe our profession needs to be lifted up and not put down.
Yeah, you're heroes.
And I think that alone helps recruitment into the area. It's more appealing to those teenagers. It's more appealing to those people that don't know what they want to do. I think all that adds up.
Yeah. Yeah, that's good. Even administrators are heroes too. So thank you for what you do at Mercy every day. Can you tell us about how the residency program came to be in the North State, and how that's helped us get more doctors? Yeah, I can't tell you who started that, as I really don't know. I know Dwayne Bland is the leader over that right now, and he came from that program. Okay. He was not from this area, came here as a resident, loved it, stayed, and now he's the leader of our residency program. I can tell you that it's a strong program. When you walk into that building and look at the pictures of the physicians on the wall, there are so many physicians from that program that are primary care providers in this community or hospitalists or whatever that stayed. That's amazing. So I think the residency, both our residency program, Shasta Community Health Center, we have 9 per year, 27 total. Yeah. And then SRMC has their internal med. I think they have 7 or 8 per year. Okay. So I think there's a real opportunity there to embrace those people and make them feel at home when they're here. We try to change our matching process to where we're looking for physicians that are from rural type communities versus LA or New York. I think that's helped our process.
But anytime we see them and we can embrace those people and make them comfortable.
Yeah.
Not all of them are the majority in this community.
Sure.
And so, just be accepting, I think it's going to help recruit the ones that are here and that are living in this community now.
Yeah, that's great. And the match program in and of itself is such a kind of a complicated thing. I think the person that created it won like a Nobel Prize or something like that. But people are ranking where they want to go. You're ranking who you want. One day a year, which is coming up, I think, in March. Everybody matches on the same day. And they don't really get a choice. If you match somewhere, that's where you're going to go. Otherwise, you might not have a future in medicine. So you're able to kind of see who you want and target those folks, and then you're able to bring them out to the community to kind of see it before they actually select this area as a top place. Is that typically how it works?
Yeah, they roll up in a van. There's like 12 of them, and they all pile out. They tour the hospital, and they go to all the sites. And that's typically how it works.
So where do you, if you could lead their itinerary for the day, which I know you don't do this, but if you could, where would you take people in Reading, these residents? When they're here, you have 12 hours to make an impression on them to move to the area outside of the facilities. Where would you take somebody? Where's your ideal day to show someone this is what Reading's all about? Restaurants, attractions, you name it.
We're so focused on nature, outdoors.
Right.
It's hard not to say you just don't start at the Sundial Bridge.
Right.
Show them the trails, show them Turtle Bay, show them everything that's down there. I think for me, and I was one of those guys from afar said, "Why are we building a bridge?"
A lot of people were.
Oh, it changed my mind.
Yeah.
That's probably where I'd start. And from there, you can see Mount Shasta. There's just, go to Shasta Dam and show them the 3 Shastas and, all that I think is perfect. So, because for them, probably what they want to see is the hospital and the medical aspect.
Sure.
But for me and in this community, you come here as a profession, but you really stay here because of everything else that's offered.
Yeah.
Right? Because you have a profession, you do your job, but it's the time away is what keeps you in healthcare for 40 years versus 15. Because if you don't take advantage of the time away, healthcare will burn you out quickly.
Sure.
I try to tell all my new employees that you got to figure out what that is that gets you out of your mind, out of work.
Right.
Because that's the only way you're going to last.
And why not live where other people vacation? I think my predecessor used to say that a lot. So it's a great place. I was on a great vacation recently, but I was excited to come home, not just because my kids were here, but we have a lot to offer. We have a lot of great opportunities. And I think it does take a while for people to kind of settle in and figure out what's going on in town. But once they're here, it grows into pretty quick.
Oh, yeah. My chief nurse loves Lassen Park. He'd take them to Lassen Park and just walk around Lassen Park. There's, like you say, there's so many things.
That's great. So, where do you take them to dinner?
Where do you take them to dinner?
Typically.
So we do, our recruits, we do this cool thing. It's wine pairing down at Turtle Bay.
Oh, cool.
Right by the aquarium down there.
Oh, nice.
Pretty nice dinner. We get a lot of physicians in the mix and our administrators and kind of wine and dine them for 3-4 hours.
That's great.
I think it's the icing on the cake. I think it's one of the reasons we have been as successful as what we've been.
Yeah.
So
what a cool program.
Oh, yeah.
And I'm sure the Turtle Bay and the Sheraton kind of work with you to put that together.
Yep.
That's very cool.
Yeah, it works
very
out
cool.
well.
That's awesome.
Yeah. Other than that, I would go to Danbury.
Okay.
I'm a Danbury guy. Sorry.
Yeah. I mean, they've been around for like 86 years, 88 years, something like that. Right behind Jack's, I think.
Yeah.
Yeah.
There you go. Well, my family came here to build the dam.
Oh, really?
My dad rode the conveyor belt and oiled the pulleys. That was his first job, and I know the story behind Damburger, and it's just hard not to be drawn to that.
Yeah.
So
you were you? Let's see. You're really not that old, but were you a damn kid? Were you a kid that lived in like one of those like housing communities that were built up quickly?
Yeah, no. I lived on Sharon Avenue in Anderson, California, all my life. So
wow. You used to live there?
No.
Okay.
Sorry.
Okay.
For 18 years of my life.
Yeah, most of your life. Wow. And then you spent time in St. Elizabeth's. And how long have you been at Mercy Medical Center now?
It'll be 8 years in March.
That's amazing. So you mentioned briefly a few moments ago that the hospital cannot employ physicians. Is that something that's unique to California?
Yes, it is. There used to be only 4 states left that didn't allow direct physician employment.
Okay.
I think California is it now, except for critical access hospitals. So like Mount Shasta can employ directly the physicians.
Okay.
We cannot do that.
California is the only state left that can't do that?
As far as I know, that is correct.
Why is that? Why was that rule put into place? It seems a bit counterintuitive.
Yeah, it's the corporate practice of medicine. They're guarding against the corporate practice of medicine. So the corporation telling a physician how to practice. And the California Medical Association is a very strong lobbying group. So they have never, legislatively, have never passed any rules that will allow us to employ directly.
Wow, that's amazing. So how do you recruit a doctor here? How does that, who is employing the physicians, and how do you kind of do that recruitment process?
So we're very lucky that we have multiple community providers that need physicians, right? So Shasta Community Health Center, Redding Rancheria. We have Dignity Health Medical Foundation, which is a branch of our corporation that they're actually employed by a physician group that we contract with.
Okay.
So there's that way. There's independent groups. Dr. Moo just became the county health officer.
Yeah.
We recruited a doctor into his practice.
Okay.
So there's a way to see those patients. So we have a lot of partners that we work with to recruit. I have 2 branches of recruitment. I have DHMF branch of recruitment. I shouldn't say I do. DHMF has a branch of recruitment.
Gotcha.
And then I have an independent branch that works with all the independents within the community to recruit.
Okay. And so you're recruiting for other healthcare groups that
Yes.
might not necessarily be employed by you. So is there any type, well, this is probably too complicated, but any type of financial benefit there? Are you're just recruiting out of the goodness of your heart that someone's going to go fill in Dr. Moo's spot at his medical group?
We're recruiting for the community to
Gotcha.
make the community a healthier place to be.
That's amazing.
That's why we recruit.
So how does Dignity Health and Mercy specifically work within the healthcare ecosystem in Shasta County? We've talked about it. You have Shasta Community Health. You have Redding Rancheria Tribal Health, which is an amazing organization. You have Shasta Regional Medical Center. You have a lot of independent providers, concierge medicine. How does Mercy fit into this ecosystem, and how do you guys work together outside of recruitment?
We are, I'm not going to say it's fortunate. I would say that we are very busy as a facility.
Right.
The more that other entities, such as Shasta Regional Medical Center, the more Shasta Community Health Center can keep their patients healthy, the more the Redding Rancheria can keep their patients healthy. It keeps them out of our ER. It frees up bandwidth to take care of the true emergencies. And I think that's kind of how we all work together. I think we're all after the same thing, and that's
Right.
a healthier community.
Right.
Without question. I
Yeah.
think every entity is along those lines. We know everybody will need a hospital sooner or later. It's just a fact of life.
That's how it goes. No one gets out of here alive.
Yeah, but the longer we can keep people healthier, the better off. The longer they can, once we have them there, to not have them come back is really, really important. You know, there's government statistics, and we get paid based on whether we can keep people healthier or not on certain quality metrics.
Right.
So all that, it all comes together. We're all working together after the same thing.
And how many other level 2 trauma centers are there in the North State? So Mercy Medical is one of them. How many other ones are in the region? What's our closest?
Inlow's the closest.
Okay.
Yeah.
Is there any on the coast?
No.
So really, if there's a major trauma that can fit into a level 2 from a big geographic radius, they're coming to Mercy from all over the place.
Yeah, we're kind of for trauma. We're kind of the hub.
Right.
We have 9 to 10 hospitals around us that feed us, including Inlow, for neurotrauma, not for trauma, but for neuro-IR, neurointerventional. We remove clots and restore the movement of people's limbs, and it's a pretty cool technology.
That's amazing.
It just blows you away. But there's about a 30,000 square mile radius that we pull from for a number of our services.
Yeah. That's great. So I was born at Mercy. Dr. Civalier, who he delivered me, and then he was my kids' doctor right before he retired. All 3 of my kids have been born at Mercy Medical Center here in Redding, and we were fortunate my kids are not that old, so they've all been born in the new wing, which is not that new anymore, about 15 years old, but it's a really beautiful spot to have the big windows. We always had one that faced east, and so it was a big window of Mount Lass, and you can see the sunrise in the morning when, especially after our first kid, it's a very rude awakening to have a kid. And then it's a big change of life.
Oh, yeah.
But to be in that facility, all the healthcare providers were so amazing. We had the same OB deliver all of our kids, Dr. Karenchis, who is amazing physician. I'm not sure. I don't think she's here anymore. But just a really great experience. So
Yeah.
I appreciate.
She was here when I first got here, and she's since moved on. But
Yeah.
she was a great doc.
Yeah,
so.
fortunately, and again, it was kind of a miracle that she just happened to be the one on call to deliver all 3 of our kids. So it worked out pretty well.
Yeah,
she was
that's
great. So you have a cancer center under construction now. What's next for Mercy? What's next for Dignity in this area? What's kind of the next thing that you can talk about for another project? Obviously, you just broke ground on the cancer center, but what's the next project for Mercy?
So we have 3 projects. The first one is bureaucratically mandated by 2030. It's called seismic. It's AB, I forget the number, but we have about $100 million we have to invest in our facility.
Oh my gosh!
And that's saw cutting between sections of the building and putting in these cement rebar walls, and there's so much there. An exoskeleton over certain areas to prop them up.
Wow.
I believe the building is extremely safe now, but it is what it is.
Wow.
So we have that project.
And we wonder why healthcare is so expensive.
There you go.
Yeah.
There's a good example. We have our empath unit, which is it's like a crisis stabilization for mental health type patients.
Mm-hmm.
Right now we house them in our ER. We got a $3 million grant to move them out of the ER and put them into the it's a chapel right now, but we're going to move into this big area and basically stabilize them and help those patients a lot compared to what we do now. It's not the right environment for them to be in. So that's about a 2-year project. And then we have when the cancer center gets built and we move oncology out of the hospital, there's 2 areas that we can establish about 30 beds in, so we can expand our inpatient capacity.
Oh, that's great.
There's a lot of times, we're a 266-bed hospital, but our adult population is about 214, and we're at 214 a lot.
Wow.
We end up holding in the ER periods of time until we free up a bed to get the patients up there. So those 30 beds will help us tremendously.
Yeah.
Unfortunately, my fear is 30 beds will help for about a month, and then we'll be full again.
It's full.
But it's a lot cheaper than trying to build a tower, a lot cheaper than trying to do that major 80 to 90 bed expansion. We have the space. It's not an approved project yet, but we do believe we're going to get approval for that.
That's great. So right now you have oncology at the hospital, but then you also have other locations throughout town. Is there any rhyme or reason why people go to different areas for different treatments right now, or different treatments within cancer, radiation one place, chemo one place, surgery one place? How does that breakdown work?
So yeah, it's not a specific area right now. Basically, chemo is offered at both sites.
Okay.
We do at one site we get chemo and radiation, and then there's a separate radiation site. So 3 different sites, and it's just whoever can get them on their schedule the quickest.
Yeah.
The one caveat to that is we do a lot of infusions. Not in our cancer centers for some supportive drugs to chemo and to the patient. We're moving all those infusions out of our endoscopy area to the cancer center as well.
Okay.
So when you go and you have chemo and you get depleted and you need certain type of IVs to help you to the next treatment, you'll go to the cancer center for that as well. So
Okay.
that'll be nice.
Everything in one spot.
Oh, yeah.
That'll be really good. That'll be good.
Yeah.
So you've lived here a long time. What is some of your favorite things to do in the North State? Some of your favorite places to go?
I think it's evolved over time, right? I lived on the lake growing up.
Yeah, there you
water
go.
ski. And, all that on the lake. Every weekend with my uncles and go out there on the boat. And
That's great.
Just have a ball. It was so much fun. I have a place right now, just property up in Shingletown. That 40-minute drive is 20 degrees cooler. And it's pine trees, and you can hear the birds fly over, and it's really. It's a de-stressor for me.
Right.
I get up there, my wife loves it, I love it.
Yeah.
We just kind of take it easy. We camp up there and just
nice.
have a
That's
ball.
fun.
So, yeah. I got into riding quads for a while up on the Oregon coast in the sand.
Dunes, in the dunes. That's fun.
That was a lot of fun. But I think, I'm at a point, I think, in my career and my life to where it's the simple things. It's the walking the trails. It's nature. It's, I used to be a bird hunter, a deer hunter. I don't kill things anymore.
Yeah.
You just get to that point, I think, and I do anyway. It's just more the relaxing, joyful things that nature and Earth brings.
Yeah.
So
That's great. So the Cancer Center, my predecessor, Jake Mangus, he left for the final stretches of fundraising for the Cancer Center, which I think was pretty much all done by the time he got there, but he's going to get the, accolades. I'm just kidding. So Jake Mangus is over there. Maggie Redmond was there before that to raise money. How much did the Mercy Foundation North have to raise for the Cancer Center? And then how much is the project total?
yeah, our typical corporate goal is about 10 to 15% of the total.
Okay.
So, although our goal has migrated north as we've gone through the process, because escalation and everything else, it just costs more money to build the thing than it did 5 years ago and 8 years ago when we got the challenge from the plumbers union or whoever that was.
Yeah.
We've been through a lot of iterations. But it's been a pleasure to work with first Maggie's team and everything she did.
Yeah.
And now Jake's team and everything they're doing. The community has been wildly supportive. I never dreamed we would have raised what we've raised. It's north of $10 million now.
That's amazing.
It just shows the true commitment to healthcare and the people of the community. And some of the, you got the bigger donors like Syrup Civic and, McConnell and other areas. But for me, it's not only them, but it's everyone else, and it's everyone. I think that's the point, right? It's everyone. And it's been a pleasure working with that team and able to thank people for what they've done.
Yeah, it's amazing. Yeah. That's going to be a big deal when that place opens up. And yeah, it is like you said, it's a good point to the generosity of our community. Mm-hmm. After the Carr fire, we were ranked one of the third most generous communities in the entire country by GoFundMe. And so, in Reading, I tell people all the time, we just kind of have to look out for ourselves. The state of California is not going to help us. They're probably going to hurt us, but they're not going to help us. Federal government, probably not going to help us. So we kind of have to figure it out on our own. And it's great to have a community that's so giving. And the Cancer Center is definitely a great representation of our community coming together. So that's really cool. Is the fundraising complete for the Cancer Center?
We're close.
Okay.
We're really,
a little
really
bit
close.
left.
Yeah, we're really close.
Do you know of other projects that Mercy Foundation's working on moving forward after the Cancer Center?
Specifically, no.
Is there food bank stuff still?
But I thought we finished the food bank. There's always projects. So we have our Macaulay Circle that there's 3 projects we always pitch to them and they always support. There's always projects within the facility. All healthcare entities have a capital appetite like you can't believe because all the docs wants the latest and greatest, right?
Right.
And we've because of COVID, because of numerous things over time, the capital buckets have shrunk. And so, to refurbish our ORs, to expand our ER waiting area, there's all sorts of projects out there. So I'm not going to tell you that Jake's job is done.
He's always got to have something to do.
He's got a long way to go.
Right.
We just have to identify the right projects that are, appealing to the donor and also meet the needs of the institution, the community.
Yeah, that's good. What keeps you up at night as a hospital CEO?
Well, we covered one of them, physician recruitment, without question. What keeps me up at night? It's not it's not as much. It used to be, how am I going to get my department staffed? How am I going to make sure I have the right employees there doing the job? And I trust my team.
That's great.
I got a great team. So I don't worry about that so much. I've got a CNE, I've got a chief medical officer, I've got my COO. They do a great job. I think for me it is more the physician component.
Right.
Knowing that I'm one physician away from having to bring in locums. I don't like locum. Well,
what's a locum?
I like locums, right? Locums are physicians that really don't necessarily have a home.
Okay.
And
nomads? Physician nomads.
And they float in and they do a week or two and then they go home. And they may come back in a couple of months and do a week or two of general surgery or take trauma call or CV surgery or medical oncology, right? So they kind of float in and they float out. I want physicians in the community that have roots here.
Right.
Our Stanford cardiac program right now, we have 2 doctors that, technically they're employed by Stanford and we contract with Stanford for their employment.
But they're up here in Reading.
But they're here.
Oh, that's great.
They live in this community.
Yeah.
They're dedicated to this community. They want to help me build that program. They are awesome.
That's great.
Dr. Greentree and Dr. Vu, who's our newest recruit, they're just exceptional people. It is so satisfying to get those type of people into the program to help build that program.
That's cool. You know, I heard about that program, but I thought there was some type of just like relationship with Stanford. I didn't realize there was actually physicians here in Reading that are Stanford physicians.
Yeah, they're affiliated with Stanford. So Stanford does all the recruitment. They employ them. They do a lot of their CME and a lot of stuff through Stanford, and they're actually considered faculty. But they're actually here in our town, and we pay to have that service covered.
That's great.
So yeah, we can't employ. Stanford can.
Yeah.
We can't.
Right.
So we have a contractual relationship to have them here.
That's really cool.
So yeah, it is really cool.
Yeah.
And like I say, Dr. Greentree was a breath of fresh air when he came. It just his collaboration and how he relates to people, and he's like a Northern California guy, right?
Perfect.
He fits well.
Yeah.
And now Dr. Vu is super nice, super smart. Just I hate to even say it, but a little tiny, small hands, which is probably good for heart surgery.
Yeah.
But and they fit so well together. They're such a good team.
That's cool.
So yeah, works out well.
That's good to have people that kind of fit the North State up here too. I know when we had our second baby, the oncologist came in to do the epidural, and this guy comes in, it's like middle of the night, super late. He's wearing like a Carhartt jacket, camo hat, red beard, I want to say. And I'm like, who the heck is this guy? Yeah. And Dr. Crunch was like, that's the anesthesiologist. Don't worry. So, but he looked like he was going to go out duck hunting in a couple minutes. So he fits the North State for sure. Yeah. But great oncologist. He was awesome.
It is pretty cool. I mean, especially when you have success.
Not oncologist, anesthesiologist.
Anesthesiologist. Yeah. So we used to, I talked about locums. We used to have.
Does locum stand for something?
No, just
nomad.
Yeah,
physician nomad.
Physicians, a lot of physicians, they like to travel.
Yeah.
So they'll do a 6-month locum stint somewhere, and then they'll travel somewhere else and do 6 months. And we have this whole panel of locums that we call in and try to bring on. They come they're not cheap,
right?
But they come and they cover service lines, which is sometimes what we need to do. We've diminished our locum use tremendously.
That's good.
Yeah, it's really good, and it's through our recruitment efforts. I look at our hospitalists. We're hardly on any locums, if any. Mm-hmm. I look at our intensivists and our ICU. No locums up there, to my knowledge. Anesthesia, we're just about done with locums. CV surgery, we're done. Our neural IR, no more. I mean, there's so many areas to where when we talk about not being successful with recruitment, that may be true on the primary care side in the community. It's not as true on the hospital side as far as supporting hospital services. And so it's been really nice. Not that we don't recruit for all, because we do. We have been very successful on that side.
That's great.
Yeah.
Are traveling nurses locums as well, or is that a separate program?
Separate program. They're travelers.
Travelers.
Yeah. I don't know that. I'm a North State guy. I'm not going to get terms or whatever. Right. They're travelers.
Travelers. And that was a big thing for a while.
Oh, yeah.
I mean, I knew a lot of people that had rentals. They were like counting on traveling nurses, and it seems like that's also changed. Are you guys having an easier time getting nurses as well?
We, in certain areas, nurses are hard to find in like critical care trained. Sometimes
because they can't come
trained.
Right out of Simpson or Shasta,
right,
and do the things that you need them to do.
Yeah, so we have internal training programs to try to get them up to speed for that. So we're better than we were, especially during COVID. Mm-hmm. COVID, we were lacking so many nurses. There were times when we had over 150 traveling nurses in that facility because you couldn't find them.
Yeah.
We're in much better shape now. We're down into the 50, 60 range. And we're trending to where we're going to go down even lower as we hire new grads.
Oh, that's great.
So we're doing much better, and we're fortunate. We have Shasta College, Simpson College, Chico State,
right?
And we take those students, and it works out really well.
That's good. So have you seen a bump with like Simpson getting their nursing program up and running? And I know it's been about a decade or more now, but has that helped you get more nurses over the years?
Oh yeah, no question. I think we made a mistake 10 years ago. We wanted to become I think the term is magnet hospital, and that means you had to have a nurse that was bachelor degree nurse.
I remember that, yeah.
And for me, it doesn't work in this size community. Mm-hmm. I think could be some advantages to it, And we help our nurses get their bachelor's degree. We offer tuition reimbursement. We offer them to go back and complete that degree. But I think where we're at and where we're trying to go, just getting the nurses, whether it's out of Shasta College, Simpson, Chico, and then train them up is the best thing for us to do.
Yeah. So you do not have to have a bachelor's degree anymore to become a nurse. That's great.
That's correct.
That's great. Although we love that program too.
Oh, yeah.
It's important for many cases, but it's good to know that you don't have to have a BSN to start right away.
Right.
Are you seeing a lot of healthcare turnover? Are you seeing a lot of people that are coming in and not sticking, whether it's a physician or a nurse? How do you keep people there?
Yeah. So we do a pretty decent job in that area. We look at our turnover rate on an annual basis. We run 16 to 17%, which may seem high.
That seems not that bad.
It's lower than the rest of Common Spirit. They run in the low 20s.
Oh, wow.
So we actually do really well there. I think it's the education. I think it's the culture. I think it's the community. I mean, I think the community has a lot to say and to do about that. You have a lower turnover rate when they're happy with where they live and what they do in their spare time.
That's good.
Not to mention their career aspirations. And, it's a challenging job and it's a rewarding job.
Yeah, so that's great. So where do you see Shasta County in 10 years?
Where do I see Shasta County in 10 years?
Outside of healthcare, anything.
Yeah, I like where Shasta County is. I've been here a long time. I've seen it grow in the right direction. I don't believe in growth overnight through the moon because I think it's too much. I think our rate of growth could be maybe a little more, but it's a nice trend in the right direction.
Right.
What you're doing in Stillwater Park, I think you started that with the EDC. Or whoever did. I think I'll give you credit because I think you did.
I opened the lock for the first time, I think.
Yeah, I think all that, I get fearful sometimes when I read certain things to where we have a restaurant that goes in and then 6 months later they're out of business.
Sure. Yeah.
Because I don't think we should overgrow.
Right.
And sometimes I think that's overgrowth.
Yeah.
But I think that slow, nice growth keeps it rural, it keeps it what we are, but it also bodes well for the future. So in 10 years, give me a population of about 120 in Reading proper.
Okay.
2 more businesses out in Stillwater that employ 200 or more.
Yeah.
And culturally continuing to work and expand on the things we're doing now.
That's great.
And I would be really happy.
I like that vision. A North State that's moderately growing.
Yeah.
That's good. I like that.
Yeah. Keep taking advantage of the recreational opportunities we have.
Yeah.
It's kind of cool that we live in the area that everybody comes to vacation.
Yeah,
I think you said that earlier.
Yeah.
And it's true.
Yeah.
I mean, it is so cool, and we don't have to go anywhere to enjoy it.
Yeah.
So,
I think it sounds like you listened to my first podcast I did with Dr. Jesse Kern, who's one of the co-owners of Prestige Urgent Care here in Reading. And one of his ideas, jokingly, was just buy all the physicians a boat. If you come to Reading, just buy a boat. You get a boat included with your package, and then you can be on the lake 15 minutes after work. So I'm not saying it's a terrible idea, but we might have some room for improvement. You can't hire a physician, but who's to say you can't have a fleet of boats?
That's true.
I'm just
I like
it out there.
I like it.
Yeah.
That's probably an earnment or something that I can't do. But
probably not.
I got
Probably
you.
not. That's okay.
Chamber could do it, though.
Yeah, that's a good point. Yeah, we could do boats for physicians.
Yeah.
The City Builders podcast is brought to you by Obsidian IT. Obsidian IT is a Reading-based, employee-owned technology company providing simple, scalable, outsourced IT for your business. Discover how Obsidian cares about IT and give them a call at 530-242-6000 or obsidianit.com. Obsidian keeps us running at the Chamber, and we could not do business without them.